I'm Mike Mersol-Barg. I'm a reproductive endocrinology and fertility specialist, and we take care of people and do our best to help them build their families. When we first meet with couples, I usually go out and greet them for a few reasons. Number one is to be here is an act of courage, to overcome the resistance of this should have been working. So I go out and greet, and we come in, and it's a real fact-finding mission to start with. And I really work with our patients to reduce the anxieties that may come when they're coming in the door so they can begin to really think about things. So I share the limits of our control. I share the limits of how good our tests are, so folks have an understanding and have better set of expectations. But they also know that there's hope. And our support group lets them know there's real hope, because many folks come back pregnant and want to share how it happened and what their struggles were in the process. And it keeps everyone grounded. And that makes us very special in our field. There's a real bond to form family. There's a real commitment, there's a true love. And we feel that for our patients as well, and we really live this with them. Even in the moments when it's most difficult, when it seems there's great despair, there really is true hope. So supporting them is more than saying it, it's showing it.
What brought us to Dr. Mersol-Barg is we've been trying to have a baby for 13 years without success. Until now. Yeah, I mean, I really felt that the doctor's main goal was to get us, our baby that we've dreamt about for so many years. He was determined as much as we were to realize our dream.
It was very, very trying, and I was very defeated. And, Dr. Mersol-Barg never gave up on us. It's nice to have somebody, make you feel like things are okay and normal, and the end result will be this.
They made us feel like family. I mean, I felt that people cared about me here, like I was their sister or daughter or niece. Like, I never felt that, I was just a number, I was just, a dollar figure, or I was just like a patient. Like, I never even felt like a patient. They offered that shoulder to cry on, and hugs are abundant in this office for sure.
There's plenty of times when we had to get bad news, and they would tell us that they'd sit there and cry in front of the phone before they picked it up to call us, and it goes a long way.
Dr. Mersol-Barg kneeled before me, and he held my hand, and he cried with me, and I couldn't imagine anybody else doing that.
When I take care of my patients, we all do here, I think about my patients as though are like me and my wife Mary Jo going through this. What would I want to know? What do I need to hear?
When you go through the whole process with a couple, you become very close with them emotionally, and when it works, it's the most wonderful feeling of all.
It helped through the process having people there that really, cared about you as an individual and not just, as a patient.
We get really bonded to the patients, and we're on that ride with them too. So when the end comes and everything is great, it is just phenomenal.
They want to do everything possible because they want to start their family. And I always say, we give you so much information, but we take you through step by step.
It's such a rewarding experience for all of us to be a part of and like to share in that journey.
So we touch people's lives.
The office feels like one big family. He was more like a friend than a doctor. I mean, very compassionate.
I have amazing staff. I mean, our embryologists are the wizards that led to the first baby from a frozen egg in Michigan. In my view, we have the perfect combination of people, and we're applying the most advanced technologies. And it's nice to know that people now can find the best technologies possible right in their own backyard. And that's what we do here. It makes a difference. It's what our core philosophy is about. It's what my life mission is for. This is what personalized care really means. It's one thing to talk the talk. It's another to walk it. And we're absolutely committed to that. We feel it, our patients feel it, it makes a difference. And if we really follow that, then the answer is easy. And now the challenge, and we're up for it, is doing it. What makes us special? The moment we get a pregnancy test result. What do?
Hello?
Diana?
Yes?
Hi, this is Dr. Mersol-Barg. How are you?
Good, how are you, doctor?
Fine, I'm with everyone. Guess what?
What?
You're pregnant!
And we
all just start screaming, "You're pregnant! Congratulations!" And it's it's the best part of the day.
He called us and he said, "What would you say if I told you you were pregnant?"
And we all get to say that magical word, "You're pregnant."
You're pregnant.
A lot of times some tears are falling and some, because we know the journey that some of the patients have been on.
And we were in shock because we were kind of already trying to prepare ourselves that it's not going to work again. But it did.
Everyone was so excited. We were so excited. We couldn't believe it. I thought it was a joke at first.
I mean, it was just amazing. I could not believe it.
Yeah, it was a nice evening.
Oh, it was absolutely amazing.
These are very special moments for our patients. I get goosebumps sharing it. And then when we see the heartbeat, it's awesome. When we see movement, arms and legs moving at 9 to 10 weeks, it's awesome. And probably the thing that gets us going, it gets me going more than anything else, is when I get to hold these little kids in my arms.
Dream come true.
Yeah, we waited a long time.
We waited a very long time, and to have this little guy, it's just amazing.
And there was a heartbeat, and there was 2 heartbeats. We couldn't believe it.
A lot of people have their first image of their kid as a
Ultrasound.
photo, but we've actually got a picture of divided cells. And I think the day that we saw that, was a different day. The life changed that day.
There really is hope. It only takes one sperm egg and healthy embryo, and we've got to do our best to make a difference. That's what it's about. Everything else flows from that.